Hey everybody, it's Anthony McMahon here. Wanted to do a quick recording. Just so you know, me and my team at ClaimLinx, we're going to start doing these once every couple of weeks, just really with the goal to show you different options that you have in the healthcare space for your business and your employees, and different things that we can do to essentially drive down costs, improve benefits, and make satisfaction overall better. With your group health plan, not only year over year, but as we're projecting 3, 5, 10 years out. These are strategies that you can deploy time and time again, and we will help you do so. So let me share my screen with you really quick to walk you through an example. Okay. So I have here on my screen a example of a 45-year-old couple with a 12-year-old and an 8-year-old. And really what we're trying to illustrate here is exactly why you do not want to buy these top level plans, such as a gold plan, such as a platinum plan or a silver plan, when you're purchasing health insurance for your employees. So I broke it down in numbers that we'll get to in this Excel sheet in a moment. But as you can see here, this is a Anthem plan in Ohio. It's an HMO. It has a $2,000 deductible. It has an $8,700 out-of-pocket max, and the monthly premium is $22.94 and 54 cents. So most people would say, you know, this looks like a good plan. We have a low deductible. It's gold. It's rated high. This is what we should set up our employees with. Us here at ClaimLinx, we take a different approach. We look at primary insurance as having two different functions for employers and for employees. Number one, from the employer standpoint, this is going to give you stop loss coverage so that if something serious does happen, if somebody has a serious illness, if somebody has a serious accident, they need medical treatment, long hospital stays, you're not going to be fully self-insuring to the point where you're assuming too much risk and your entire plan can get blown out with one serious thing happening. Secondarily, from the employee's perspective, what it's going to allow them to do is actually have the entire provider network that, in this case, Anthem has open to them, so they could see all their same doctors, all their same specialists, everybody in between that they're accustomed to seeing, regardless if they're on a gold plan or a bronze plan, like I'm going to show you here in a minute. But really what we want to do is boil this down to a math problem for you. So I'll show you what I'm talking about here in a minute. So we have this plan at $22.94 a month. As I said, $2,000 deductible, $8,700 out-of-pocket max. But if we go over here to a bronze plan, same family, same outline, everything we just talked about, I'll show you the difference in price. And this isn't even including subsidies and household income, which could drive down cost even further, but wanted to just kind of show you a generic option here. So here we go. Same HMO plan, $9,100 deductible, $9,100 out-of-pocket max. And this is what you really want to focus on here is there's only a $400 difference in the out-of-pocket max that you would be on the hook for as an employer and an employee. But you can see here that your premiums went from about $2,500 per month all the way down to $12. Now, what I broke down here in this Excel sheet shows you exactly what I'm talking about and why employers should be purchasing health insurance in the way that we should suggest here. So that number one, you're guaranteed to save on every single employee. Number two, you eliminate your risk. And number three, with these additional savings that I'll get into here in a moment, you could actually provide your people with better benefits. So I will break down each plan really quickly for you. So here is the gold plan with Anthem Blue Cross Blue Shield. That, like I said, it had a $2,000 deductible, $8,700 out-of-pocket max. The monthly premium was $22.94 and 54 cents. Annually, that went to about $27,500. If we contrast that to the bronze plan right here, $9,100 deductible, $9,100 out-of-pocket max, a monthly premium of $1,208, your annual premium would actually look like $14,496. So in a comparison standpoint from an employer, you're going to look at this, the out-of-pocket max. So this plan has an out-of-pocket max of $9,100, and that basically means from an out-of-pocket max perspective, anything above that, that's when insurance kicks in 100% and takes care of any claim, any bill, any health service that your employees will actually be consuming throughout the duration of the year. After this number is met, that is exactly when insurance will kick in and take care of the rest. So you can see this plan, $9,100, this plan, $8,700, but the premium difference per month is drastic. And what you'll see is you're essentially for the year assuming $400 more of risk, but you're paying $13,000 less in premium each and every year. Provider at hospital network, exactly the same. Type of plan, exactly the same in HMO. And really what I want to illustrate here is why you should buy this plan as opposed to this plan. And the reason is because number one, you're guaranteed to save. Even if you went with the deductible versus deductible, it's a $7,100 difference. But you can see here in premium, and this is right on the marketplace website. You can see these are real plans. Even if you went deductible to deductible, that's $7,100 difference, but you're still saving $13,000 in premiums. So no matter how you slice it, you're saving and guaranteed to save on every single employee if you're able to actually set up your plan in this way. And what most of our clients do with these savings is that they actually give them back in the form of better benefits for their people. And that's when we introduce what's called a medical expense reimbursement plan. All it is a vehicle that allows you to utilize Section 105 of the tax code and allows you to actually reimburse hospitals and providers on your employees' behalf only when and if claims come in. So you're no longer prepaying for medical expenses, prepaying for claims. You actually have a vehicle in place that allows you to essentially self-fund underneath that primary insurance and take care of your employees' medical bills with these savings that you're guaranteed and have locked in through purchasing insurance in the correct way. So overall, that's what I wanted to share here in this webinar. I hope that this was valuable. I tried to keep it under 5-10 minutes, but I hope that those numbers really illustrated why every employer in America should be looking at bronze plans, getting that primary catastrophic coverage in place, inserting a medical expense reimbursement plan underneath of it, and then essentially self-insuring with stop loss coverage above that, guaranteeing savings, improving benefits for your employees, and just making it a more sustainable vehicle over time that your employees will ultimately be happy for, and your business will thrive, and reduce your second or third largest expense every single year. So hopefully that was helpful. And yeah, any questions that you have, definitely feel free to give me an email, amcmahon@claimlinx.com, or you can reach out to me via LinkedIn. Thanks so much.